Yes, I was. I was like, oh, if I had known, I probably would have worn a tux as well.
Exactly, and
Maybe
then maybe send a makeup artist to you as well to make you up.
exactly.
Oh well, oh well. But I mean, this is the thing about mental health. You have to just be comfortable in who you are. You have to be comfortable in what you're
Yes,
doing.
exactly.
And I am comfortable. And I think I'm looking good, really, even if I have to say so myself. At least I'm feeling myself, as I say.
Yes, you are. You look amazing. Honestly.
Okay, cool. So, do you all think I look glam? Do you think I look beautiful? Well, I feel beautiful from the inside, and I'm sure it's showing on the outside. And I've had a nice day today. So, pretty in a good place. I hope you're all in a good place as well. So, Tolu, how's your day?
Quiet. Just the way I wanted it to be, and it's just perfect that it's a rainy day, so everything is nice and cool and calm and quite relaxing. I love rainy days. I find them very relaxing.
Oh, you do? Interesting. Really? So, I'll keep that later. It's something I want to say. And you have to tell us what you find interesting and what I think might be interesting. So, good evening, everyone. It's been raining in Lagos. And how was your week, really? I mean, it's Saturday. Parties, obviously, you can see the way I'm dressed. We are now back to the party scene. And it's been, I'd say, for me, the week has been a bit. So my dad was ill and was in hospital, and he just literally just got out today. So
Okay.
I think I'm feeling much relaxed than I was before,
Okay.
And so
How's he doing though?
It's doing good. It's good. It's been released from hospital, so it's good. It's eating now, healthier now, and if it's quiet, there's a problem. But now it's back to his trouble. So that's a very good sign.
How old is your dad?
86. It's 86.
Oh, okay.
Still quite young.
Yes, actually, it's a young man.
Yeah, quite young. So, so, I mean, it was easy for me to remember I could go out today because I was thinking, oh gosh, will I be able to do this ID live,
Right.
But then I just knew when you just commit everything to God and just let it be. So I'm good. I'm happy that's back at home, and I could enjoy my party as well. And I'm here today. So how was your week?
I hope you also maintained the COVID protocol. Very important.
That's extremely important. That's extremely important.
Because we're not really out of the woods yet. So
no, we're not. So one has to really, pay attention to that. As much as you want to go out, as much as you enjoy looking good, dressing up, you still have to be mindful of the fact that COVID is still out there, and being vaccinated twice or having your full dose of vaccination doesn't mean you're COVID free. Because I do know of someone who had both vaccines and still currently has COVID.
Yeah.
So and then we have the cases in the UK as well, and that people with the vaccination dying or having COVID. So let's be mindful of the fact that COVID is still very much around, and we still have to follow all protocols. Tolu, I think we're losing you, or are you guys losing me? If you can hear me, please wave. Because Tolu seems as if it's frozen. Can you guys hear me? Or is it me? Hell. So I think we may have lost Tolu, but he will join again. Please wave if you can hear me. Can you hear me? Please wave. Thank you, Kate. Thank you, Lady K. So we've just lost our speaker. As I said, it's raining. It's here in Lagos, so it must be a network issue, but it will join us shortly. So let's talk about itself. So how was your week? I already spoke about my week. How was your week? Just put comments in the chat box. Curious Works, how was your week? Alternative View, how was your week? Thank you, Simi. So this is not my usual look, really. So I'm glad you're saying I'm looking good, because I was self-conscious initially, but I think I'm okay now. Okay, Lady K, it was stressful. I hope it's much better now. Thank you very much, Sia Accessories. Thank you. I'm very well. I'm very well. Very well. I'm very well, Oluwadiaga. I'm good. So we're waiting for Tolu to join us again. I would rather glam, yes. My friend's son got married today, and I had to like rush home, and I didn't have enough time to remove the face and just get back to my normal look. But I thought, why not? If not, and besides, we're talking to somebody from Lagos State today, so why not? Echo for sure. Okay, Tolu is back. Let me take him. Let's go live with Tolu.
Right, so I don't know but I just kind of dropped off for a second there.
I know, with the rains, our network in Nigeria is a bit funny. I mean, it's funny usually, then it rained again, so
makes it worse. Yes, exactly.
Exactly. So it's back. It's good to have you back.
Thank you.
Thank you, Curious Works. So I think we can start. Are you ready for us?
Yes, I am. Very. I'm looking
Tolu
forward
is
to this.
back. Tolu is Alternative View. Tolu is back on now. Can you see Tolu? Can you guys, Tolu say something so we know they can hear you?
Hi. Hello. Can you hear me?
I can hear you, so and they can hear me, so
right.
I believe they can hear you too. So
okay, great.
Thank you very much for joining. Thank you so much. And we've been having this series called Refresh series, and the aim of this whole refresh thing is to talk about various topics, but lately we've been talking about mental health. And we've had mental COVID and mental health, really. So we've had the psychiatrists talk about children and mental health and COVID. We've had adults. We've had music, the effect of music on music. We've had just before you. I mean, we've had another few ones, which are all on our YouTube page. And then the last one we had was on sleep and rest.
Right.
The effects of rest and sleep and COVID, really, and basically just our mental state, why rest is important, and we learned how to sleep as well. That is on our YouTube page as well. So please go to our YouTube page. It's Refreshed Healthy Living. And if you don't want to watch or you don't want to go to YouTube page, it's all on our IG page as well, the Instagram page as well. And what we do is that we summarize everything we've learned, we take out the salient points, and we put them on our IG page as well. So it makes it easy for you to go to and refer to. So today, I mean, we've done a lot of talking about mental health, COVID, and and you would agree with me. There's a lot of talk about mental health, about self-care, about talk to somebody, about do this. But it's okay when you're abroad, when you have all those things. But us in Nigeria, who do we talk to? Where do we go to? In as much as we say that we're evolving with time, are we really evolving with time? I remember speaking to a psychiatrist saying I went to talk to a friend of mine that came on the show who has bipolar, but she lives in the UK and she's had it since she was 16 and she was going to talk about it. And what she said to me is like, Duntan, why are you putting that up there? Blah, 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 blah. That's a personal thing. I mean, bipolar, So I was like, but she's happy to talk about it. She's happy to come and talk to people about it, to tell people what to do, and that having bipolar is not a life sentence.
Right.
She was a great event planner, and bipolar led her to start doing something called Event Well, where she caters for well-being for the industry, industry, which I'm still part of. So really and truly, there's nothing wrong in discussing this. I know it's a taboo here to say, fatigue, or I'm stressed, or you say, well, I think if the one wants to use the word, I think I'm mentally stressed. What they think about is Yaba Akosi, which is Yaba Let, which was the main psychiatric hospital in the past, and still one of the strong ones going. But things have changed. Lagos State has taken the lead on these, and Tolu will tell us why they open up Lagos Mind and what they do at Lagos Mind. So the aim of this particular session is to direct you where you can get help, where you can talk to people on the other end. They don't know who you are, but they're there to listen to you. They're there to direct you in the right direction and to make sure you stick this up. I mean, you can call them anonymously without anybody knowing. Your friends don't have to know, the people in your family don't have to know yet until you just want to talk. There's sometimes that you just want to talk. You just want to talk to somebody that gets you. But nobody gets you because they think you're losing it. They think you're mad. But you are not mad, but you just need to express yourself. Lagos Mind is there to do all that, I hope. Tolu, you correct me if I'm wrong. So that's why we're here with Tolu today. So I'll introduce Tolu to you. I'm going to have to wear my glasses. So Tolu is a medical doctor and a specialist in public health, global mental health, international health management. This is serious accolades. So health programming and data analysis. Oh wow, gee. So I guess we have the best here from Lagos State. And Tolu serves as the coordinator of the mental health project of Lagos State and is the mental health desk officer for the state. So you'd agree with me that we have the best person here. And I want to assume that this is not just for Lagos State, but this is nationwide, because we have people in the north, people in the east, people in the southwest that would need to get this, they need to speak to people as well. So I want to assume that Lagos State is just taking the lead and everybody else can phone in from anywhere in the country. So as I said, Tolu is a medical doctor, and I'm trying to read your let me just read your citations so that it's much easier. So Tolu serves as the coordinator. I've said that, blah, blah, blah. Tolu has coordinated and facilitated a number of mental health projects, including the Mental Health Better Access Project, Maternal Mental Health Program. Oh, then really, that's very good. Lagos State Mental Health, Motor Park Health and Safety Program, and the Lagos Lifeline, and the Lagos Mind as well. It was also a part of the Lagos State COVID response, serving as a member of the Emergency Operations Center for Mental Health and Psychosocial Support, and a member of the Committee for the Establishment of Lagos State Mental Health Law. He is also the Secretary for the Act for Life Community, a Ministry of Health initiative created to promote the integration of heart in healthcare. Oh, that's fantastic. I really like that, because at least from my little training, I know that when you paint or you do word search, you release tension, a lot of tension, So recently we had an event program, and whilst we're waiting for everybody to gather, we gave them some things to paint. And initially they were like, oh, why are we painting? This is for children. But the moment they got into it, I mean, I could see the change. They were more relaxed, they were more into the event. And I think I would say we had a more productive event than we've had before, because everybody was relaxed and they gave more of themselves. They were intentional and they were present. Yeah. I'm not going to say more. Tolu is an alumni of the Imperial College London and a member of the Nigerian Medical Association, an association of public health practitioners of Nigeria. Thank you very much, Tolu. Thank you for joining us. Thank you for your time. We really appreciate it. And Tolu, I know you said it's been raining. And I know you said you like your coffee. So I'm assuming your coffee has been laced with brandy. So you're a bit loose today. So you can really... So we expect you to flow. Okay, so
yeah, I mean,
now, sorry?
Yeah, so yeah, I mean, it's the perfect weather for it. It's the perfect weather
for brandy and coffee, right?
Yes, it is.
Okay, we're not going to talk about that now. Let's talk about mental health and access to mental health. So thank you, Tolu. Thank you for joining us. Please welcome Tolu. And Tolu, please introduce yourself and your link to Lagos Mind. I think I've said most, but I'm sure you have much more to say.
Yeah, so thank you for this opportunity. It was really great to hear from you, and when you brought this up, I found it to be a very interesting opportunity for us to talk about some of the things that we do in Lagos. Lagos Mind is essentially our mental health in development project, where we try to integrate mental health into the general health system of the state, but also to advocate for, the reduction of the stigma associated with mental health, and of course, improve access to information and knowledge around mental health and where mental health services are available. So we, in 2017 was the first opportunity we had to begin to explore the use of telephone services for mental health. Yeah. So at that time, it was the April 2017, when it was the World Health Day, and the theme for that year was Depression, Let's Talk. And so the commissioner at the time thought that, it was an opportunity to begin to explore how we could use technology to increase access to services, and also to explore how people are willing to adopt that as a method of accessing care. And so we got a few numbers that we put out there after doing a press conference on the World Health Day for that year. And within the space of about a week, we had about 1,000 phone calls coming through.
Oh, wow.
And so we had, different people calling for different cases, some dealing with, serious mental health issues, others dealing with social, concerns and social problems that they needed assistance with. And so, that served as the framework for us to begin to look at and explore how we could, easily adopt this as a state. Now, we understood at the time that there were other people, who are working in that space with whom we have some partnership. So we have SERPIN, which is a suicide risk prevention initiative, which has its origin in Luth, but I think they have volunteers and workers who are spread across the country. Then we have some NGOs like Mani, I believe, who were also doing some work in that space as well. But so, we thought that it was an opportunity for us as a state, because we had certain things we could leverage on. We had systems, we had infrastructure, we had the workforce that we could explore, and integrate together. So when people called, it wouldn't just be those who, were able to afford private care, but also people who couldn't afford private care but needed help. We're going to be able to access help at our public, facilities in the state. And so COVID happened in 2020, and we decided to explore that opportunity further. And one of the pillars that was set up at the time as part of the COVID response was the psychosocial support system. Now, this was hinged on the fact that we had a number of people who, were having a lot of anxiety, with diagnosis, with information around COVID. And of course, there was a lot of stigma. So, at the time, there was also the lockdown around the state, and people who had COVID would call and, they would send an ambulance to pick them up, to take them to the isolation center. And then, we saw the videos out there where people would, say that, oh, don't go to that building anymore, don't talk to that family because someone from, that house had COVID and all of that. So there was a lot of stigma. So even people coming forward to, report the symptoms that they had was also a huge concern. And then, of course, getting information after they'd gotten tested was also, quite, difficult, because at the time, the initial process was that if you tested positive for COVID, someone would just call you and tell you, look, you are positive and you need to come in, right? And so just breaking the news to them, kind of also created a lot of anxiety for a lot of people. So we had a whole team, that was set up of over 150 people who, when the results were available, were passed to the psychosocial, team, where counselors, psychiatrists, clinical psychologists would call, the owners of the test results and break it to them in a way that will be more acceptable and, reduce the impact of the stigma and anxiety around it. And of course,
I didn't get that phone call.
Oh, did you test positive as well?
Yes. And I just got a phone call that said to me, oh, you're positive. And I'm like, okay, so what next? Follow the protocol. What is the protocol? And,
okay, so that must have happened much earlier, in the
no, that happened this year, actually.
Oh, this year?
This year, end of February this year. And I was like, okay, so you don't do, so I was like, you don't call someone and just say, you're positive, follow the protocol. And the person was like, oh, but you're positive. I'm like, I'm not arguing with you, but I expected it to be better. I knew I was positive, even before the results came. Well, I kind of knew in my head, you knew the changes, but I didn't think. But I mean, so I'm surprised that you had this in place.
Yeah.
But
So
I didn't get that phone call, and nobody called me after that till today.
Okay, so
you don't follow up on me.
There's been a transition in, so which is why I'm trying to take you through the journey of how a lot of the response happened. So initially we had the lab professionals who were the ones breaking the news. Obviously they were busy with a lot of the work of trying to run the tests, and so they were under a lot of pressure to be able to put those calls through to people to tell them that, oh, they tested positive. And of course, people were not receiving the news well, which was why, we had to take on that responsibility of breaking the news. And then, of course, the first wave ended and then the second wave started. But at this point, there was a lot more information out there. So the anxiety around being positive for COVID wasn't as severe as it initially was. A lot more people were accepting, of what it was. There was a lot more information in public about what COVID is, even though, there was still a lot of rumors going out as to whether or not COVID was real or not. But it was much better than the initial period where people were saying it was caused by 5G or that there was some space alien flying around and just making people sick and all of that. So at that point, we reviewed the response and then we decided to take a different approach. So towards the end of that second wave, the peak period of the second wave, we decided to rearrange our strategy around how we provided psychosocial support. And at this point, we had a Echo Telemed service, which is our general healthcare service that provides access to the public and people can call in. And that was also around the period where we had started the home-based care. So, during this period, we didn't have people coming into the isolation centers anymore. People were being managed at home.
At home, yeah.
And so,
I remember.
Yeah. So all of that period, there had to be an evolution in the response. As the things were changing, we also had to evolve in the way we're responding, to the pandemic. And so our approach became very different because at that initial point, where people were being admitted in the hospitals, we had some of our team members who will call patients who are on admission to speak with
Okay.
them, just, counsel them, just talk with them and walk with them through the process. We had team members who were responsible for disclosures, calling people to tell them whether or not they were positive and how,
Okay.
they were able to share that information. And then we also had team members who were responsible for after discharge, because a lot of people, after they had gotten better and gone home, had to deal with the stigma of, neighbors and colleagues who were, very, trying to stay away from them because there was a lot of poor information about mental health at the time. So, but, as information increased, right, and people became more aware and a lot more people got COVID and they found that, it was something they could recover from, we changed our methodology. So we decided that, taking that initial approach was no longer as necessary as it initially was. And so we stepped back, and what we decided to do was, integrate with the Echo Telemed service. So they were the ones primarily responsible for, passing out the message about whether people were positive or not. And then based on their conversations with their clients, they would be able to make an assessment on whether or not person would require a therapist or, further psychosocial support, and then they will pass that to us for us to, deal with. So I guess, maybe the initial conversation with you was quite reassuring on their end to say that, okay, you don't seem to be taking it too badly, and you're able to cope. So, just following a lot of the information that was out there was probably I'm not just trying to play devil's advocate, and because, they're my family, I have to support them. And, which was probably why they, took that approach that they did. But I mean, we've had to also, so as part of our evolution, we decided that, it was about time that we had a dedicated mental health service, telephone service, beyond COVID, and to deal with other issues around mental health, mental illness, and, just general social issues. So we understand also that there are not a number of people out there who, had a number of engagements that they had to also request for, some support from the state. And we thought that, you can't really have too many people working in this space, because COVID was a great opportunity for people to begin to understand what mental health was about and how that got more people required support. So it was fantastic, hearing and seeing how people were always talking about self-care, talking about, looking after your mental health. And then, of course, being cooped up in the house, for extended periods of time, dealing with financial pressures, dealing with, domestic issues. Some people had strains in their relationship that they probably didn't really pay attention to because they always had to go to work, and so never had that time, to sit down at home and deal with some of these things.
Exactly.
And
that
so,
was a big
so the lockdown allowed a lot of these things to show. And, while we also, had to deal with more awareness around mental health, we also knew that at that period, there was a lot more cases of domestic violence, sexual violence and assault. And of course, that had its own, mental health repercussions as well. And so we have, state structures that deal with some of these things, like the DSVRT that manages domestic and sexual violence response under the Ministry of Justice. And they've had, a significant number of cases, even before COVID, where they had to help, rape victims to seek for justice. But in also doing that, also had to make sure that, they had access to therapists who would be able to care for them. And a lot of that time, we have, a number of NGOs that have been working in that space, in collaboration with the state to be able to do some of these things. And so we have resources in the state as well that we felt that, okay, this was an opportunity for us to also integrate with what they were doing, so that, people are not restricted to certain number of people. And then, of course, the burden on those people would also, reduce. And
good idea.
Part of working through all of that was also to ensure that we had access to, professionals across the space, both in the public and private sector. So we had, access to a lot of resources, relationships, structures for social support, for social justice, for direct mental health interventions. And we decided that, we should have a hub that we can tie all of these things together, you know, so that, because a lot of times we realize that people generally do not have a lot of information around what the state has, you know, available. And we thought that, you know, having a central point where people can call in and, you know, either just need someone to talk to because they're, you know, dealing with certain stressors in their lives, or, you know, having family members who had maybe children dealing with substance use, which also is on the rise, you know. And
I know, yeah. So the psychiatrist that came on child mental health said he's based in Canada, and he said after a session, the increase of children's suicide or substance abuse, just, you know, has just been on the increase. And it was in the news as well. Then Canada was on the news because it's based in Canada. That's the rate with children is really, and it was something we all neglected, or most people neglected, thinking that the children are resilient and they would be able to cope. So saying that, this will lead me to my next question. So if, for example, I have a teenager come online and phone, do you have people that can deal with teenagers? Because it takes a teenager a lot to come out and even voice what they're going through. And we need people that will really support them and make them feel, what's the word to use? Because I mean, I take teenagers to church, comfortable, and I know how they can be so caged because they're going through so much. Their body is changing. I mean, they're growing up. Their hormones are everywhere. They're realizing they have these, you know, things are becoming more aware. And then all of a sudden they are cooked up. They have, so that they may have COVID, or the parents are going through a lot of them with domestic violence, and there's domestic violence in the house, or they don't understand. I mean, as we know, they think we don't understand them. So if a teenager picks up the phone and calls you, is there somebody that can say, I don't deal with teenagers, but I can lead you to the right person. Just hold on a second and I'll take you to the right counselor that can speak to you. Do you have that available?
So what we have a mix, the kind of, so we have what we call intake counselors, who are the ones that manage the lines. And,
sorry, Tolu, 1 second. 1 second, please. So we are not talking about, someone has been talking about drug abuse and rehabilitation. Today's topic is not about drug abuse, but we don't want to neglect that because obviously it's very important as well. And I believe Lagos State has a rehabilitation center in Ekwe for drug abuse. And I think if you do go to the general hospital, you can, I don't know, Tolu, that's not your desk, so I'm not sure you have that information about drug abuse. But I'm sure we will, if you call the helpline, somebody may be able to direct you. But today our focus is more on the mental health and not the drug abuse. But I believe there used to be one in Ikoyi, which I think shut down a few weeks ago, a rehabilitation center for drugs in Ikoyi, somewhere now off our lower road, but that shut down a few weeks ago. And
privately owned?
I think it's privately owned, yes. And there's one now in Ekwe. I'm not sure, but please check.
So I mean, we have quite a number of providers. So, because you know, there's a very strong correlation between substance use and mental health.
And mental health.
We have, you know, a number of people who develop mental illnesses because of substance use, and we also had people with mental illnesses who became, you know, addicts to a lot of, you know, psychoactive substances. So I mean, it's part of the larger conversation, right? So having, you know, people who are able to provide rehabilitation, you know, and which is largely a healthcare service, you know, clinicians who are experts in that field. And we have, you know, a lot of resources and networks with these people, both in the private and public space.
Oh, thank you very much.
That we engage with. So so I mean, in the last few weeks, most of my calls that have been coming in have largely been around parents, you know, looking for help for their children who are dealing with, you know, substance use, or who are having, you know, coping problems, or have become more violent and aggressive in the home because they have been, using a lot of psychoactive substances. But yeah, so I mean, that is a whole other conversation that
exactly.
we have some time. Yeah. So, but I mean, so it was leading to what I was referring to when I said having that proper integration and a hub for being able to provide access to a lot of these services. So a lot of people probably don't know. So we have one of the projects by the Ministry of Health called Hello Lagos, which are youth-friendly centers, and they are supported by UNICEF and I think FHI 360 and a couple of other international organizations, where they provide services that are largely directed at young people. And a lot of people, so a lot of people in the public space have been using some of these services, and I think they've been quite helpful. So having a mix of counselors who are young and older, who are able to understand a lot of the minds, and one of the interesting things we found when we first started this project was that a lot of people who were accessing the service were younger people. The average age was about 22, 23, but we had people as young as 16, some as old as 65. But, the numbers were largely skewed to the left, right? So more between the age of 16 and 30 were the ones who were either calling in or either engaging with us on social media, through the ones that are currently available and those that were previously available. And we're able to use that opportunity to also track. So one of the things that we started later on was doing a social media tracking, where even if people hadn't engaged with us directly, just by studying their feed, right, and just watching through hashtags, we're able to identify red flags and those that we thought may need access, may require help. And so we're able to make that first push and not necessarily wait for people to, reach out to us.
You. Oh, that's fantastic.
Yeah. So yeah, so that was one of the newer things that we adopted, and that kind of increased the access and utilization of the services that we had available. And we're exploring other ways that we could use technology to be able to predict, which was why one of the things that I found very important was data analytics, data science, because it allowed us to be able to study the trends, observe the kinds of populations that we're targeting and how to reach them. And we found that if we increased our social media promotions and engagements, we had a certain demographic that we're able to reach out to. If we focused on radio, we focused on TV, we had a certain demographic that we're also being able to reach out to and get to talk with. And so exploring all of those opportunities allowed us to begin to evolve the kind of service that we have. And so I would say that the telephone service, which we call the Lagos Lifeline, is alive, basically, because it grows, it evolves, it is adjusting, it is moving, and is irresponsive, to how the trends are, because the human mind is, versatile and evolves. And language also evolves. And because we want to be able to ensure that we're continuously, providing kind of service that is relevant to the people that we're in touch with, we evolve accordingly. So as the language changes, we're changing our language. So Lagos Mind was essentially the way that we thought, we're able to access a lot more young people and provide, access to information around mental health. So we have the website lagosmind.org, where we try to push out as much information as possible around mental health. Then recently we started animations, around children's mental health. So we have one in English, and then we're working on a Yoruba version as well, so that we are trying to diversify and make sure that the information is out there in as many understandable languages as possible, so that we can increase uptake. For us having the service, access to service is important, but we felt that, more importantly was having access to information, because the more the better you are, and better you're able to make decisions that affect your health or the health of the loved ones around you.
Okay, I know you said you're trying to have the animation in Yoruba, but we know Lagos is cosmopolitan. We have people that speak Hausa, Igbo, and
Pidgin,
they all make us
so many other languages.
they all make up Lagos, really. So is there any, are you looking at doing the other languages apart from Yoruba? And
Yeah,
even
so
speaking English.
because English, so we started with English because we know that that's the general, official language of the country.
And Pidgin English?
Yes, but so we wanted to see how the uptake would be if we, you choose one language first, see what the response is like, which is why I said we're trying to be as, so the feedback determines whether or not we continue with that approach. Is it effective? Because most importantly with messaging is ensuring that you have the appropriate feedback. Engaging the people that you're reaching out to. So if you find that, putting in resources to either convert a message to a different language is not working, you want to see whether the message itself has a problem, or maybe the translation has an issue, or the mode of delivery of that message is, an issue. So it's all scientific for us, right? So doing all of this is intentional. It is data driven. It is, methodological. Yeah, I think that's the word I was trying to go for. It's very methodological.
We understand. Don't worry. We understand. We grab the message.
Yeah, so, trying to ensure that everything we do is, very scientific and very intentional was very, very critical for us. So, exploring other languages is definitely on board. And doing that, we're also looking at how to be able to use other languages to be able to carry out messages around mental health on different, conditions for women who are pregnant, because postpartum depression is a huge thing. It's a very big issue. Other perinatal mood and anxiety disorders are also very, very significant. And I think they've been underserved, for too long.
Yeah.
And the only time we ever really hear about some of these things is when, people have begun be pushed to take extreme measures, like I'm sure you're aware of the one about the lady that drowned her baby in a barrel. So, and a lot of times we still have all of that conversation. So, oh, she's a witch, is this, is that. Meanwhile, the lady was dealing with significant mental issues that she needed help with, but she didn't know how to identify that she needed help. And then, of course, that she needed to even talk to anyone. And, with a lot of experts in the mental health space, one of the key things that they usually would emphasize on is called insights. Understanding that you have a problem is always the first step to being able to solve that problem.
Solve it, exactly.
But a lot of times people who have mental health issues do not even understand that they're actually dealing with significant mental illness unless someone points it out to them, and then they're able to, seek care.
So how does somebody even know they're dealing with mental health? And I'm saying this, I'm putting this out there because, there's a saying that's saying almost everybody in Lagos is crazy, and we know that Lagos is stressful. We know the stress of Lagos. We know the stress of just going, even just sitting out in traffic, it's stressful. So I'm a normal person. I do my 9 to 5. I want to go home. I wake up at odd hours to make sure I get to work on time. I leave work late and I get home late. I have maybe 4 hours sleep, and then the cycle starts all over again. So gradually, I'm burning out, but I'm not saying it until one day I snap.
Yeah.
How do you put it out there that people can just talk to somebody? How do you put it out there that, okay, you know what? Before it gets to the stage of snapping, you can reach out to us. I mean, maybe because I'm in this space of mental health, and healthcare, I'm more aware of the signs, the symptoms when you're having burnout and when you need to take a break. But how does a person out there even know what to do and what the next step is?
Right, so messaging is important. Messaging is very critical. So one of the things we've identified, right, is that because of the nature of Lagos, a lot of people spend a lot of time in traffic, and people have certain preferences for what radio stations they listen to. So, we've had, a lot of experts who have, been able to engage with a lot of our radio presenters during peak periods, right, to talk about mental health.
Mm-hmm.
To also be able to explain the difference between mental health and mental illness, to
Mm-hmm.
also be able to explain what signs to look out for, not only for people who are listening, but for people that they know who may be having things that they could relate with, from what the expert is saying.
Mm-hmm.
And by doing that, you're able to identify and say, okay, I mean, there's also very important for us to be able to separate information, because a lot of times we hear people say I'm depressed, right? If they lose a loved one, they say I'm depressed. But I mean, or you fail an exam, you say I'm depressed, but you're sad, right? But you
Yeah.
don't start talking about depression unless that sadness becomes prolonged, becomes extended,
Mm-hmm.
and becomes either harmful to yourself, to your normal way of doing things, or harmful to the people around you. And when you start contemplating things like helplessness, hopelessness, and even almost considering ending your life, or you need to use certain psychoactive, maybe alcohol or something, to make yourself feel better, then you know that you're dealing with things that are becoming more pathological. But feeling sad is normal. Everybody feels sad at some point or the other. Getting angry is normal, but when you become violent, of course, it's when you know that you have a problem. And like you mentioned about how Lagos is, one of the things that is becoming more paramount and a front burner for us as a state, which our commissioner has been piloting, since he became commissioner for health, is the whole concept of One Health. Now, One Health talks about how there's an engagement between the environment, human
Mm-hmm.
health and agriculture, and how that interplay is very critical, maintaining
Very.
that balance. So having a healthy environment, having healthy animals, having healthy, ecosystem, impacts significantly on human life. So for example, the whole COVID thing, there are speculations that it came from an animal source. The whole Ebola thing started from an animal. So being able to manage, the agricultural space, the animal life, the plant life, and of
Mm-hmm.
course, climate change itself is very impactful on mental health as well.
Yeah.
So imagine that you're sitting in traffic. The weather is extremely hot. You do not have air conditioning. You're inhaling carbon monoxide from vehicles around you. Everyone is pressing their horns and it is really loud and really noisy. There is no way you won't get stressed and become aggressive at some point, because you probably feel like someone is driving too close to you, invading your space, or trying to take over your lane without trafficating appropriately, or you have people driving one way when that makes you feel like, oh, why am I not doing that as well? I'm trying to maintain a sense of civility, but other people are doing otherwise. All of that has an impact on our mental health. So we understand that even the environment, even our regular social spaces and other factors can, impact on our mental health. But, this whole conversation around resilience has been part of what, yes, has been sustaining us to some level. But even that definition has to be properly looked at, because what we now consider normal in Lagos, if you go to maybe Ekiti, for example, they would think you're absolutely weird, because the way of life there is different. The environment is different.
Mm-hmm.
They are not as aggressive as Lagosians
And
generally
then we
are.
shall be aggressive.
And it's because of all of us being cooped up in that small space, all of us trying to make that money, and of course deal with all of the pressures that come with it, leaving your house at 4 a.m. and then you get to work and you have to be kind to your customers, and people will complain that customer service is rubbish. But you're dealing with people who had to either walk long distances, or they get in a bus and the bus has doubled its price before,
Before,
just that
yes.
morning. And then they get to work, they either get splashed on by muddy water, or someone steals their purse. So there's no way you meet that kind of person in the workspace and you smile at them and expect them to be all cheerful all the time. Some of that stress will also impact them significantly. So even in the workplace, I think it's important for us all as people to begin to give consideration to everyone around us, because we're all dealing with a lot of stress. Now, this is not even including the fact that maybe back home there are some serious issues going on with the parents, or with the husband, or with the wife, or there's no work somewhere. or you're dealing with children who are ill, or who are dealing with some chronic issue, or who are not doing well in school. So all of that pressure impacts significantly on people's minds. And so, I mean, beyond saying, okay, we are only dealing with people with severe anxiety disorders, or with severe mood disorders, or people who are schizophrenic, or people who have suicidal ideation, just being able to talk to someone, about some of these stresses generally helps. Having that space to be able to say that, you know what, I'm really tired today. I had a long day, this happened, that happened, and not keeping all of that in your chest. Like we always say, having that outlet is always a good thing.
Important. It's extremely important.
Yes, and it has helped a lot of people. And the way our environment is evolving, we're having less of that, family engagement. We're becoming more individualized, like how the whole African community used to be, where we used to be community oriented.
The whole village, is your family.
Yeah. But now everybody just stays in their homes. If you live in an estate, you probably only come out to see each other on your way out to work, or if you even engage in estate meetings. But check it. Most people don't even know who their neighbors are. They don't know their first names. They don't know what they do. And it didn't used to be like that before. So having all of that individualization, has its impact, of course, on our mental health, because now you don't have someone you can talk to, about some of the things you're dealing with. So developing support groups, developing, engagements that can, help you thrive is probably things we're also looking at. But we're using the Lifeline as a hub to be able to do a lot of those things. Okay. Yeah, and increase a lot of that engagement.
Okay, so for example, I mean, yes, we have a Lifeline, and the number I think was pinned earlier. What if have you thought of having like a community where people can just go into, like, you had the AA, the Alcoholic Anonymous in the past, where if you're an alcoholic or you're a recovering alcoholic and you need to just talk to other people in that space, is that something you're looking at that you have in various communities, that you can just come in, like in a community center, somewhere central within the community or local government area, and people can come into and just have like an evening of saying maybe an hour or two, meet people with like going through what you're going through, talk about things with a psychiatrist being there or a counselor being there, and they can help them just relieve things. For some people, even I think the line free. Is it a free line? Because a lot of people in Lagos think about, well, if I call this number now, I say I have mental problem, I'm calling these people now, they are chopping my data, they are chopping my money, now they're adding to my problem. So is this line free? Is it a free line? You know how we think.
So I'll address both things, and I'll just walk you through some of the thinking around that. So for the support groups, what we have done is, the whole idea of having support groups is still a bit foreign to us, general African culture. Meanwhile, the truth is we have been doing this a lot without actually calling them support groups.
Exactly.
I mean, for example, we have some of our churches where we have men's meetings or we have women's meetings, and a lot of times you have opportunities to either talk to the leader of the group or the pastor or someone who says, oh, there's somebody else who's dealing with the imam, and then they have been acting as support group systems. And because we don't call them support group system because it seems to be more Western or more European, we are trying to, see how we can adjust that and make them more targeted at certain things. And we have a lot of organizations who are sponsoring some of these activities. So for example, now people who are dealing with certain disease conditions. So we have disease-specific support groups. So people who are dealing with cancers, we started a pilot in the General Hospital Lagos, where people who are dealing with breast cancer, different kinds of cancer, were able to come together. And, they meet with people who are survivors, right? Who have talked about how they needed to do a mastectomy, take out their breast, and how they're alive, they're fine. And there's encourage others who initially said that, no, I was not going to get surgery, take out my breast, to go forward and do it. And by doing that, they've been able to save their own lives. So what we are also looking at expanding into is to form HIV support groups. I know that some of these are being sponsored by, donor agencies. We have also observed that TB is on the rise. So we're trying to also do something for tuberculosis, to develop like support group systems to, on one hand, encourage people to make sure that they take their medication, which is the main objective, because it can get tiring. Because, you have to use medication for up to a year or 9 months at least. And very tiring. So imagine not having anyone who you can speak with who is probably dealing with the same thing, to be able to say that, okay, how did you cope? What did you use to inspire yourself to continue going forward, to make sure that, so, all of that is very helpful. So we also have, we're planning to start one now for patients who are schizophrenic, who also need to, make sure that they continue with their medication and, avoid becoming defaulters. And that is being sponsored by, some other organizations. So we have people who have been coming forward to say, okay, you know what? We know that resources are limited, but this is the part that we want to play, and this is where we're trying to, support. So where do you need help? And then we say, oh, we've started this, but we would, for us to be able to sustain it, what can you do to help with that? So yeah, support groups are critical, but we're trying to, make them more targeted, more specific to different areas. Now for the number, it is not toll-free, but it is not expensive. I'll explain why. I'll explain why. During the initial period of the COVID response, we had a number of toll-free services. And what we realized was that 60% of the calls that were coming through were hoax calls. So we had people who were calling in just to say, oh, is your line working? Or some people calling in to say, oh, I'm looking for a girlfriend. Or, people calling in.
It's a mental problem.
No, I mean, not necessarily. But I guess, it's free. So it's not at the charge to them. But, toll-free services are not necessarily free because somebody is paying for it.
Paying for it, yes.
And then if people who need the service are not able to access it because others who feel like they can just take advantage of that service and just waste, valuable resources, do that, it becomes a problem. But what we now thought to do was that, we're not trying to increase the pressure on people. We know that on average, 1 minute of a call is about 22 naira or 25 naira. Right? So if you put that initial call through, once we reach that mark, we tell you, what, let's call you back so that we save you resources and you don't have to waste your funds, and we can have this conversation for as long as you want to without being, a charge on you. And so that is what we decided to do, as so that you make that initial step, because
and then you follow up.
People, and then we follow up. So because people can pick up their phone, and a lot of times one of the things that we had studied and found out was that a lot of times you have people who say they don't have money, but if you check it, they spend money on things, right? So I guess we would spend money on what we think is important.
It's important.
And so if you're going to be able to provide help for people, they need to also see it as being important to them. Otherwise, you don't get the outcome you're looking for, because now it will seem as though you're the one putting pressure on them to get things done, which really isn't what we're trying to do, right? So you can't, say, oh, I don't have credit, but next minute you pick up your phone and then you're calling your auntie or some neighbor somewhere to gossip about somebody down the road that did something that upset you. I mean, even if you flash, we will call you back. If you call and the call disconnects, we will call you back. If you send an email, we will call you back. So
actually, I must say that works really, because I called initially when I was looking for you, and and I realized that it was just some number, and so I dropped the phone, and I didn't speak to anyone. I was still going through the options. And I dropped the phone thinking that, okay, this is I'm blocking someone that needs this number. And then I got a call back to say, how may I help you? And I was like, oh, I'm actually looking for, so, someone I could talk to that can just bring this to. And I think then somebody else called me. So I think I got like 2 calls from you from my initial phone call. I'm not even speaking to anybody. I'm just dropping the phone saying that, okay, I better look for a better way rather than blocking up, engaging the line. And somebody that really needs the line at that point in time is unable to get, access to it. So yes, I do I testify to the fact that you do call back even when someone is playing or calling and not even speaking to anybody. So that's very good.
Yeah. So the other thing we also did with the system was to also create alternate channels. So we have alternate channels where people can just listen to stress management tips. We have an alternate channel where people can actually do positive self-affirmations. So, I mean, things that you can say, right, as you're listening, just to, improve and inspire your mind, inspire your mindset before you go into your day. So, I like to encourage people to, be able to access that as well. Just, give a call number. If you don't want to speak to a counselor, you can dial all the other alternate numbers, options rather. Get, some good stress management tips, which we had a lot of work to do and work on. The other thing we are trying to do now is have celebrities also come in as volunteer counselors. So what they will do, you wouldn't know, but what they will do. So like someone like you, a huge celebrity like yourself.
Excuse you.
With.
Excuse me, because I'm dolled up today. Don't be fooled.
I mean, so maybe when you're available, when you're free, you can come in. Just spend a few hours talking to people. When they call in, I find it quite encouraging. We've had a few people, some of whom really wouldn't want us to mention their names, but in the beginning, we also had the commissioner also come in, sit and take a call as well. So but he just introduced himself by his first name. Oh, hi, my name is Akin. This is the Lagos Lifeline. Blah 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 blah. So that way, we're trying to also encourage more ambassadors to also talk about mental health, talk about the kind of services.
So in short, you're saying, come and join. You're trying to fool me, but I'm sure we'll find.
I hope it's working.
Offline. Now we're just making sure people get that information. So you've spoken a lot about so many issues that are very important, but one thing you haven't spoken about is heartbreak. And we tend to underestimate the fact that when someone is heartbroken, they go through a lot. For example, I'm dating somebody, I mean, it's going well. I presume it's going well. And all of a sudden he says to me, but I'm just not longer interested. But why aren't you interested? I didn't see the signs. I didn't see anything. And then you're there. For women, you lock yourself up, you cry. Men do cry. So it's not just women. So let me not say women. For men or women, you lock yourself up, you cry, you don't want to talk to anybody. You're just going through the whole process. But you turn to your next door neighbor, you turn to your friend and say, oh, I can't believe she did that to me, or I can't believe he did that to me. And they say, oh, come on, get on if you meet somebody else. But it is a problem. It is a mental stress,
Yeah.
Do you deal with that? Do you deal with that issue of somebody phoning up and saying that my boyfriend just broke up with me, or my girlfriend just broke up with me? Is there care for such people?
Yeah, so we've had people who have called, just to speak around that. The first time we got one of those calls, one of my counselors found it a bit humorous that, she'd been having calls with people who either called to report someone who was a vagrant psychotic, right? Or dealing with people who called to say, oh, I want to end my life, right? Because I can't cope with the stressors. And then to just suddenly get a call from someone to say, oh, I'm sad because my boyfriend broke up with me. She was taken aback, and so she informed me about it because, sometimes we have some of these engagements back and forth when they're off duty. And I said, what are your thoughts? What do you think? Do you think it is not significant? And she said, compared to what she had been,
Been
talking
dealing with.
about, or the people she'd been engaging with, she just felt it was a bit more mundane. And I asked her if she had dealt with heartbreak before, like she had her heart broken. And she said yes. And I said, how did you feel? And she said, oh, she felt like her world was going to end. She was really sad. She was, for days, it affected everything. And I was like, so did you think that it would have been important if you had someone to talk to at the time? And she said yes. And she stopped and then she smiled and said she knew where I was going, right? And then I kind of noticed, so the trend now increased. We had a few more people who called to either report that, they're still trying to deal with the fact that their boyfriend cheated on them, and they don't know what to do. We had one of those calls where a lady just had a baby and her husband just decided to walk out of the house. And she had 2 other children with her and she didn't know what to do. And she called, I think, about 11 p.m. thereabout, and she was on the phone with one of my team members till about 1 a.m. She was just crying. And then he called me at the time, and I thought, okay, what was going on? And he said, so and so was, what he was dealing with. So I told her, keep calling her till morning, just check on her, see how she's doing, which he did. And, she found it a lot more encouraging, right? Because it helped her to deal with,
to go through the night,
emotion, right, or throughout that night. But I guess more importantly was also to help her to try and see how, she could help herself, right? What do you have, family support? Do you have people you can talk to? Do you have, family members who can understand what you're dealing with? Do you need us to get you, someone to talk to professionally to be able to deal with this? And so we've had calls like that, and because it is a huge issue, especially among young people, because we've also had people who committed suicide because they got their heart broken. So it's not something that we're taking lightly. And it's interesting that you mentioned that, because we're thinking that in August we're going to do something specific around that, because it is largely ignored, because we just generally assume it's a regular social issue. Everybody has had a heartbreak or some point or the other, and they've been able to work through it. So, but we don't realize that a lot of times when people get their heart broken, subconsciously and somehow it leaves an effect, it leaves an impact on us. We carry that into the next relationship, either the insecurities from that relationship or the hurt and the anger from that relationship. And then the next relationship suffers because of that, because you've not been able to resolve the issues that you had. Sometimes people deal with self-image or self-esteem issues because they felt they were not good enough before, which was why the previous relationship ended. Meanwhile, it may not even have been you at all. It may have been the other person. And so you go into the next relationship insecure. You go into the next relationship feeling that, oh, I'm not good enough for you, or what can I do to become better for you, without actually dealing with, taking the time out to deal with someone. To deal with yourself and make yourself whole, Yeah, so so it's one thing we're also trying to look at. It's not as, it's as important, right? But it is not as morbid as dealing with, people dealing with manic, episodes, or people dealing with, addictions, right? But the value of what that you can provide addiction as well. So this could be a foundation as well. Exactly. So it can be a precursor, right, for people to begin to look into other things, which is why we said, we need to also begin to look at how to be able to identify some of the trigger points, right? Yeah. When people initially present with that initial emotional spike, and see what you can do about it before it becomes chronic. And that way you help, people deal with their emotions better and improve. And which is one of the reasons why we decided to also target children as well, and the first animation we did was around understanding emotions, right? So they know what it means to be sad and what it means to be happy, what it means to be disappointed, what it means to be hurt, what it means to be jealous, and, understand what can make you feel that way, and, knowing that understanding your emotions is the first step to understanding yourselves. Oh, fantastic. That's great. I'm glad the fact that you're touching on children,
emotions, teenagers, so it makes it that it's all rounded. It's just not focused on one particular set of people. So, and the fact that you have various people that can talk people through whatever it is that they may be dealing with. So in terms of if you're not in Lagos, so this takes me to my next question. If I'm not Lagos based, say I'm calling from Kaduna, are you in partnership with other state governments? Are other state governments doing this, what you're doing, or is it just a Lagos initiative? I know they say in Lagos we are the pace setter. So is there any, do we have any other state that's picked this up as well that you're working in partnership with? Because I believe that if we have this in all the 36 states and the federal capital as well, we'll have a better nation. We'll have people more stable, and I think we'll have we won't be as aggressive as we are.
Right.
So is this something? Can you shed light on that? This was a Lagos State initiative.
Okay, so as it is, with every state, you look at your own residents first to try and see what you can do to help them. But because it is a tech, based service, it doesn't have boundaries, right? So you can have people calling from Ghana, you can have people calling from the UK, you can have people calling from anywhere, right? Either looking for support for themselves or hearing about what you're doing and see if you can provide support for someone that they know that lives in Lagos, right? But we've had a few calls from people, who live in Ogun State, who live in Edo State. There was one call from, I think from Kano or Kaduna, I'm not quite sure at the moment, where they needed support. Now, because our thinking was we have 20 million people that we needed to serve, we needed to be able to provide a robust service for them. It became important for us now to begin to identify partners, right? So one of the things that we decided to do along, that line is to also speak with some of our other, partners and professionals who are working in this space, like Serpin. Now they have, partners across the states, across the country. And of course, engaging with the ministries of health in the other states as well, for us to also link up with them. So we have like focal persons in each of those places. And in some cases, we have direct links to facilities or professionals in those places who are, once we get calls from them, people in that state, we can say, oh, okay, this is a certain person that we know you can talk to, but we will call you right back. We will call that person, explain what we're dealing with, and of course, get the connection with back to the person. So it's like kind of like you're booking an appointment for a patient, right? So you're calling the professional to say, oh, I have a patient who lives around you who needs help. When can they come in to see you? And then, call the person back, say, okay, you know what, this is where you can go. This is the contact person, this is the contact number. And so our service has now begun to look like it is more, subnational, rather than just, regional. Well, because it's the way technology works. There's no way you can start something that's tech-based. And technology doesn't have boundaries, right? So you can have conversations with people anywhere in the world. But so having access to resources, to people who are able to provide help for them locally is a huge challenge, but it's something that we're working aggressively on.
Oh, fantastic. Thank you very much for that. I'm glad that, we're not limited to Lagos, and as you said, and we do have telemedicine video. You can speak to your doctor in the States, in Australia, in Hong Kong, wherever, without leaving your home. And they can tell you what you need and where to go to, and because they do have partners everywhere. So I'm glad that we're taking that initiative. I'm glad we're moving forward with that and actually looking more globally than just insular in Lagos State, which is a very big plus to you guys. And you've answered some of my questions, that those behind the phone lines, they're trained, assume they're trained counselors, so they don't come in. So another thing again that people fear in our country and in our environment is confidentiality.
Confidentiality.
Confidentiality. Yes. Confidentiality. Can I speak to you and tomorrow is not on City People, or is not on one of the blogs, or one of the newspapers, tabloids, saying that, oh, Duntan called and she may be having a mental breakdown, or and people are afraid of that. I'm not saying 60 people is
I know, right?
Whatever. But it was just the name that came to mind. But so what I basically mean is that it's not gist out there, right?
Yeah.
It's not gist out there saying that oh, I've spoken to, because eventually my name at some point. You have my number.
Yeah.
You can trace me.
Yeah.
I can trace you. But then there's a fear that I'm speaking to you and tomorrow I'm seeing it's there or it's gist. How do you train your counselors to say, look, this stays here and stays within the comfort, within this area, it doesn't go out. It's not even, as soon as you step out of the door, shut it down. Because people need to have that, in order for people to phone, they need to have that trust. You need to build that trust, to know that I am getting support. My people in my house don't have to know, because at the end of the day, it's up to you to want your family members to know or not, especially if you're an adult. So are you saying that there's that trust there?
Yeah, so that's very important for us. Now, on 2 levels, or 3 levels. As a state, we have signed a data compliance policy agreement, right? Where we have, and which is one of the things that we're driving around the ministry. We're trying to use our ministry to propagate the importance of data protection, because we deal with a lot of patient data, patient information, which is very, very sensitive. And so the state, as a ministry, is signed to that. We have binding regulations around data protection, and there are very strict regulations and very strict punitive measures for where data leaks. So on the state level, we have that governance level that is very, 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 very robust and very, very strictly adhered to. On the local level, in our center, all of our counselors have a background in psychology, and on a very regular basis, they have training with experts around different subject matters. And one of that is around customer relations and data privacy. All of them have unique user IDs and passwords that they use for the systems that they log into when they take calls. So as an oversight function, we are able to even monitor all the calls that come in on all the systems. So if people's data leak, I can tell from where it leaked, from whom it leaked, at what time it leaked. And we do not allow them to use their personal devices to do any of the work that they do. So they are not able to take in information that they work with home. So we are very, very sensitive to that, because mental health is still something that is largely stigmatized. So trust is very, very essential. It's very, very key to making sure that what we're doing works. And so we do not play with that at all. We protect our data. Everything is encrypted. We can't even be leaked. So we were initially contemplating on having cloud servers to store some of the information, but we decided to stick with local servers that have backups, just to make sure that the data stays protected, stays local, and cannot be hacked. So it is totally shut down and shut off from any kind of interconnectivity where you can have hackers try to steal your information. None of that happens, and we've invested a lot of resources to make sure that happens.
Oh, fantastic! That's very reassuring. So, if I want to call you, are you 24/7, or are you do you shut off at a particular time?
So we started initially running a day service, starting at 9, running till 5 p.m. But we left the system on to be able to also track to see if we get calls at night. Because we also, like I said, it is a responsive system. So as people, as the demand grows, we're able to, match it. And then we realized that we had been getting calls in the middle of the night, but most of them get stuck on the IVR, so they use either the stress management or the self-affirmation tools, when in a few times they wanted to speak with a counselor. And a lot of times people either also send emails, right, requesting to speak with someone. And we also found that during the day, people are either at work or in school. They're mixed with a lot of people, so they don't even have the privacy to be able to have some of the kind of conversations that they want to have. So we decided to expand and have a 24-hour service. So we have
fantastic.
people who work during the day, we have people who work at night to ensure that every point in time there's someone available for people to talk to.
Oh, good. Fantastic. I'm very happy with that. So I know we've gone well over our time, but
yes, we have.
believe...
But I mean, if you don't mind, I'd like to just share some information, if that's fine with you.
No, I was just going to say that if you have anything you want to pin, please pin, and then would like some information from you. So, because I mean, obviously, we're going to give a summary of what we've learned today, or what we've not learned, what you've given us today. That's going to be on our IG page. We hope you would put it on your IG page as well, so that people can access it as well. And so we know that we would like your email address, we like the phone numbers. We have put the phone numbers out in the past, and if you notice on all our IG lives, as soon as we realized Lagos State launched Lagos Mind, well, I didn't know it had been in existence since 2017, but COVID has its own blessings, as it were. Even though we're in a pandemic, there are still so many good points that have come out from COVID. So one of the things I would say is, don't look at the negativity of the pandemic. Look at what you've gained. Look at how you've developed yourself. Look at the resources available to you. Lagos Mind had been in existence since 2017, but it's only just 2020, 2021 that we knew about this. So COVID, that's a good tip for COVID. So in every situation, always look for the positive side. What is there that is positive, And Tolu, thank you very much. So we all know that Lagos Mind and Lagos Lifeline is a confidential line. It's 24/7. You can access it from anywhere in the world. We know that your story, your situation, whatever it is, will not leak. I know in this space, sometimes you just want to express yourself, but you need that person that will not judge you. You need that person that would listen to you. So Lagos Mind, Lagos Lifeline, people are on the other side of the line that would listen to you, not judging you. They'll just hear you rant. So I just want to pick up the phone and say, you know what? I just bought this piece of meat and I think this. They're that, whatever you want to say. Tolu, right? So I can I can just say anything. People are there to listen. And we know that once you express yourself, you actually feel better. There's no need for those things to rent space in your head. I mean, tell them that you're full.
We have the space for it.
Lagos Mind has a space, so we'll just
pass it to
Lagos Mind. Give it to Lagos Mind. They're ready to take it, and make sure you just free your mind so you can do more things.
Exactly.
Thank you very much, Tolu. Thank you so much for taking this. Thank you for honoring our invitation. And as I said, with all our other IG lives is on our YouTube page or on our IG live. Particularly, I must say, our music, IG live on the effects of music and our mental well-being, we couldn't put that on our YouTube page because of copyright issues. Instagram wasn't letting us download it or transfer it to YouTube, and understandably so, because we played a lot of music. I mean, you can't have DJ shows in the house and not play music, so there was a lot of things, and we spoke a lot about the effect of music and our mental well-being. So please go back to our IG live or YouTube page and listen to these things. Our aim is to make sure that we give you all the resources to make you a better you, a refresh your other living. Our desire is to make sure that you're better. We bring out the best in you. We work on that journey with you. So that is why we have Lagos Mind. Everything was said, we can talk about everything, but if you don't know where to access care, it's just all noise. So Lagos Mind, thank you very much. And
thank you very much.
I don't know.
Really nice to. I've not been able to get over the whole look. It's really good, really nice. Did you do the makeup yourself?
No, I wish. I really, really, really wish. And you know, the funny, and you said something about positive about affirmation. You know, when I was coming on and I was trying to get everything ready from the wedding, and I was thinking, oh, maybe I should still go and change. And I thought, oh no, I will not be able to clean this face, change and everything, and be ready for 7. So I said to myself, oh yes, you're beautiful. Actually, you're beautiful. And you know, I kept on telling myself I was beautiful. It's a different angle. We're talking about Lagos State. Lagos State is a go for show. So this is real show. So, and by the time I came home, you know, I was gingered. I was ready. I was confident. I felt I owned myself and my space. So positive affirmation really works.
Yes, it does.
Thank you.
It works. Wonder works.
Yes. That's my event company. So thank you very much. Thank you everyone that joined us this evening. We would be back again in 2 weeks. I don't know what we're going to talk about, but you will know shortly. But thank you for sharing your evening with us. We really do appreciate it. Now it's time for you to get ready for sleep. So start.
Yes, exactly.
Go back and learn. We learned about how to sleep and how to get ourselves ready. So it's almost 8:30. Time to start shutting down. We need to shut down this blue light as well so that you can get some sleep and you can be refreshed for tomorrow. Exactly. So we'll see you in 2 weeks' time. Thank you very much, Tolu. Thank you very much.
All right, thank you.
Have a good evening.
Have a good evening.
Bye.
Bye.